Hello, everyone. It looks like it's about 6 o'clock, so I'll go ahead and get started with our webinar, Genetic Counseling, the Career for You, hosted by the Texas Society of Genetic Counselors. I wanted to start off by thanking everyone for joining us tonight. I know it's been a long day, so I really appreciate you guys sticking with us. Today, it'll be 6 speakers. I'm Rachel Wyatt. I work at the University of Texas Health San Antonio. I am a genetic counselor who sees both adult and pediatric cancer patients. A little bit about me is I actually got started with a degree at Texas A&M University. I had a bachelor's in genetics with a minor in psychology. And then after that, I got my master's degree from the University of Alabama at Birmingham. And then I ended up back in San Antonio. As you guys can see, I was actually raised in Austin, not too far back. So a couple of housekeeping items, if you guys can remember to just keep your microphone muted during this webinar. And if you think of any questions along the way, please feel free to submit those in the chat. Today, we really plan on just talking about what is a genetic counselor and what is genetic counseling. Then why does one become a genetic counselor? And then lastly, for those interested in the profession, what exactly does that process or those steps look like to becoming a genetic counselor? So what is a genetic counselor? Genetic counselors are professionals who have specialized education in both genetics and counseling to provide personalized support about one's genetic health. And this is a definition provided by the National Society of Genetic Counselors. This is kind of the main body for genetic counseling and provides a way for us to promote professional issues as well as network. So what is genetic counseling? It's the process of helping people understand and adapt to the medical, psychological, and familial implications of the genetic contributions to disease. And this is really all done with the ultimate goal of, sorry, the slides are acting a little wonky. Well, I'm having a hard time going back, but the ultimate goal is to help patients with their decision-making process and to best utilize that genetic counseling information in regards to their family. There are multiple reasons why an individual might be referred to see genetic counseling, whether that's a personal or family history. And during our session, we really focus on trying to get a little bit more of an understanding about that medical and family history so that we can create a personalized risk assessment for that individual. A risk assessment can be for the chances that they have a condition, but also if you do have this condition, what's the chance that other family members may have it or that you'll develop specific features within that condition. We also talk about genetic testing options available to them, and sometimes prevention and management options can be dependent on having a genetic diagnosis. And then we also want to make sure we include emotional support in that session. So that can be both short-term counseling within the session as well as providing them with access to support groups later on. So why do people get genetic testing? There are a few different reasons why an individual might see a genetic counselor and discuss testing. for an explanation, whether they have a personal medical history or a family history of a condition, if they've had abnormal test results or exams, or even an ultrasound during pregnancy. And sometimes people come due to fertility problems or multiple pregnancy losses. It can also be used in regards to clinical management. So there are certain treatments, surveillance, screening, clinical trials that are only available to individuals who have a genetic diagnosis. And that could be a genetic diagnosis through testing or even having the clinical features of a condition. And then also for family planning purposes, so learning the inheritance patterns of a condition or what exactly are the reproductive options available to an individual who knows that they either have a genetic condition or at an increased risk. So genetic counselors can work in a variety of settings. This includes within university medical centers, which provide you also with opportunity to not only see patients, but provide educative resources to individuals. So for example, in my specific job, I often teach classes or guest lecture for medical students as well as genetic counseling students. We can also work within hospitals and laboratories, although I will say when you see laboratory, it's not necessarily the typical thought of bench work with micropipetting and things like that, but kind of acting as the bridge between what does a molecular test report mean in regards to a patient's real life. And this can mean a lot of communicating with other providers. They can also work in nonprofit and government positions. And especially since COVID, but even prior, there's a lot of remote work as well. And this work can be in a variety of different specialty areas, with the most common specialty being cancer genetics, which is about 30% or a third of genetic counselors, and the next prenatal genetics. And then some people work in multiple specialty areas. So you don't have to simply be a prenatal genetic counselor, but you can be a cancer genetic counselor who also sees metabolic conditions or adult conditions. So genetic counselors wear multiple hats. Some of the roles that we fill include being a clinician. That's when you're gathering and analyzing that medical and family history to create a personalized risk assessment for the individual, informing them about genetic testing and going over their genetic test results if they have any, and also developing a personalized medical plan based off those test results in your session. You can also provide support for those individuals. So not only are you giving them this scientific information or these medical terms and information and guidance, but also just the support they need in short-term counseling or connecting them to a long-term counselor or any sort of resources and support groups. And then you're also an educator. Yes, educating the patient, but also other healthcare professionals, the general public, and students as well. So we do work as a large team. It's never just you as a genetic counselor. There, depending on your specialty, that'll kind of determine which members are a part of your team. But it's really going to be a mixture of other doctors, psychologists, specialists, and this happens both before your session. So there are a variety of providers that can refer someone for genetic counseling, but also afterwards, when someone does have a genetic diagnosis, part of our role is making sure that they're connected with the correct healthcare team. So now we're going to talk a little bit more about the specific specialty areas.
Hi, my name is Hannah, and I am originally from Columbus, Ohio, and I have an undergraduate degree from The Ohio State University in molecular genetics, and I am And then I went on to complete my genetic counseling training at Baylor College of Medicine, and I am now a genetic counselor at Baylor College of Medicine and Texas Children's Hospital in the pediatric hematology department. I'm going to be talking a little bit about some of the specialty areas in which genetic counselors work. And so the first one I'm going to talk about is prenatal. So the prenatal GC will see couples who are pregnant or planning to become pregnant. And while there are many reasons why someone may want to see a prenatal genetic counselor, some of the common reasons or indications would be advanced maternal age, or someone who, or an individual who's over the age of 35, abnormal screening results for some of the tests that are offered during a pregnancy, a known family history of a genetic condition, or if there are any abnormalities seen on ultrasound during the course of a pregnancy. Prenatal genetic counselors are well-versed and able to talk about many of the different types of tests that are offered during a pregnancy. And prenatal genetic counselors focus on discussing what these tests are, the accuracy, what these tests do and do not provide, what information they can and will not provide a family, as well as the types of results and accuracy and things like that. One of these tests is, or one type of test is a blood screening test. And this is used to evaluate the chance of a chromosome abnormality in a pregnancy. So for example, a pregnant person may get a blood draw that will look to see if there is an increased chance of the baby having a condition like Down syndrome. Genetic counselors are also able to discuss ultrasound screening and some of the ultrasound abnormalities that may be suggestive of a genetic condition, which we can see an example of here in the picture. The black and white picture is an example of an ultrasound where they're actually looking at a fluid-filled pocket at the back of the baby's neck. And if this is increased, it makes us think of certain types of genetic conditions. Ultrasounds and blood screening tests aren't necessarily able to tell us yes or no a baby has a condition, but rather there's an increased chance. And so genetic counselors are also able to discuss the option to proceed with diagnostic testing, which actually takes a sample of, for an amniocentesis, takes a sample of fluid from around the baby and is actually able to give a yes or no answer in terms of a diagnosis. And that procedure is also pictured on the slide as well. Some families do decide to meet with a genetic counselor for preconception counseling. And so this includes a discussion of carrier screening to see if both partners are carriers for the same condition. If that's the case, then there's a 25% chance to have that condition. And some couples decide to come to a genetic counselor to discuss their family history of disease and the chance for their future children to have that condition. Some couples do opt to do pre-implantation genetic testing and actually test an embryo prior to being implanted for a pregnancy to determine if the embryo and then the baby will have that genetic condition. Moving on from prenatal, I'm going to talk a little bit about pediatric and adult genetic counseling. So in the pediatric clinic, patients are typically under the age of 18. And some of the common reasons why we might be referred a patient would be abnormal newborn screening, metabolic conditions, intellectual disability, failure to thrive, or dysmorphic features. And for the adult clinics, typically those patients are over the age of 18. So any adult with a known genetic condition, a family or a family history of a genetic condition, or a likely genetic condition, things like early onset heart disease, Huntington disease, or any other condition. The outcomes of a pediatric or adult session, they're very similar. And so one outcome or goal of these genetic counseling sessions is to help end the diagnostic odyssey. Oftentimes, families have been looking for an answer or an underlying reason for someone's symptoms. And so genetic testing can sometimes provide that. And by providing that, it allows us to make changes in treatment or recommendations in medical management and allow to help coordinate care, especially thinking about different specialties that this patient may need to see or may benefit from seeing. And switching gears a little bit to a more specialized adult practice would be cancer genetics. And so cancer genetic counseling and testing is really focused on predisposition for certain types of cancer. Cancer genetic counselors will take a detailed family history and look for certain red flags in a family. So this would be someone who's been diagnosed at an early age or prior to the age of 50, has had multiple or bilateral cancers, cancers that we consider to be linked, or we know that there's a gene that can cause these different types of cancer. So breast and pancreatic cancer, colon and bladder, or breast and ovarian cancer. And then when we see multiple generations in a family affected by cancer, and it looks like someone could be, or this could be inherited in an autosomal dominant pattern. We also look for rare cancers in a family. So male breast cancer and ovarian cancer is also considered rare. Cancer genetic counselors work, it's really helpful to have a good partnership with your oncologists who will also ask some family history and personal questions to get some of these red flags. And then they're referred to a cancer genetic counselor to discuss in more detail and to talk about what testing may be helpful for that family. Switching from the clinical side of genetic counseling to more of the industry side would be talking about genetic testing and how genetic counselors can be involved in that. So one way genetic counselors are involved is by just working directly for a lab who offers genetic testing. So laboratory GCs kind of switch their clientele from working with patients to working with clinical genetic counselors, physicians, and other healthcare providers that may be ordering genetic testing. And they really become a liaison between the lab and those healthcare providers. They're able to provide us with information and data on genetic testing, assist in the communication and clarification of genetic test results, as well as help us to determine our best testing approach. And then they also will help write some of the lab reports, which we heavily rely on to help us explain the results to the families as well. Another way that genetic counselors can participate in more of a potentially non-clinical role would be a research genetic counselor. And so this is, they may still see patients, but they're more considered their participants in research. And they also work with recruiting physicians and institutions. The goals of their work is coordinating recruitment to the research study, as well as enrollment of patients and their families, and to help guide those participants through the informed consent process and explaining the research study in an understandable manner. They're also able to write grants, which helps to get funding for their research. I think we're seeing more genetic counselors in specialty clinics like cardiology or even specific disease clinics like cystic fibrosis, as well as psychiatry, neurogenetics, and then I work in hematology. And I think we're going to continue to see genetic counselors move into these specialty clinic roles and meet needs in those clinics as well. As far as a day in the life of a genetic counselor, I like to say that no 2 days are alike, and I'm sure many of my colleagues on the call would agree that we have a lot of responsibilities and we perform a wide variety of tasks. So some days we may be specifically just seeing patients, whereas other days we're more on the phone, talking with, following up with our patients or talking with testing labs, insurance companies, or other healthcare providers. We also help to order genetic tests, and we do provide documentation, not only in the medical record, but we also provide results letters explaining the results to the patient, but then we also can provide family letters to help inform the rest of the family of the results as well. Some genetic counselors are involved in research, while others are also involved in developing educational tools or presentations, whether that's for their clinics or people who may not be as familiar with genetic counseling. And then many of us supervise learners in the clinic, whether that's genetic counseling students or other medical trainees as well. So why genetic counseling? I think there are many, many reasons to be a genetic counselor, but to name a few, genetic counseling was named one of the 25 amazing healthcare support jobs in 2017 and one of the 100 best jobs in 2019. So I believe we were number 7 in 2019 on the list of best healthcare support jobs and number 36 of 100 best jobs. And of course, number 1 in our hearts. Looking at some of the numbers, employment of genetic counselors is projected to grow 21% through 2029, whereas for other fields, average growth is around 5%. And I think that speaks to what a booming field this is. And also along the same lines, more than 74% of our graduating GCs in 2020 had accepted a position before graduation. The average starting salary for a new grad full-time genetic counselor in 2020 was a little under $77,000, with salaries ranging up to over $200,000, but that depends on specialty area as well as experience. And a vast majority, 90% of genetic counselors report they are satisfied with their job. Some of the other highlights for the genetic counseling field is it is a very flexible job. We take a board exam once graduating from a program, which allows you to practice anywhere in any specialty. You also have a lot of autonomy and expertise. You work as a member of a greater healthcare team, but you really become that expert in genetics and the go-to for your team, as well as your patients in terms of the genetics questions and genetic testing and really understanding those results and how that impacts the family. Also, genetic counseling is a really emotionally rewarding job. You really get to meet families where they are and help people during a vulnerable time in their life, and spend a lot of time getting to know them and their needs and being able to support that. And so it can be very rewarding and lead to high job satisfaction. And I think we're going to switch over to talking a little bit about how to get into the field.
Yes, so my name's Emily Magnus, and to tell you a little bit about myself before talking about this profession, I am a native Texan, and I went to Trinity University and got an undergraduate degree in biology with a minor in chemistry. I completed my master's training at Baylor College of Medicine in Houston, and then now I currently work as a pediatric genetic counselor at the Children's Hospital of San Antonio with Baylor College of Medicine. I know that there will probably be a lot of questions about getting into the field, and I've seen some already on the chat, so I'll do my best to try and answer some of them. As my colleagues have gone through a little bit already, there are a lot of reasons to become interested in genetic counseling. And I think that most individuals that want to be genetic counselors kind of have underlying similar interests in working with people and communicating. They have that interest in science and healthcare as well. And then working with different patient populations and people of all sorts of diverse backgrounds is another kind of quality that a lot of genetic counselors share. There is no one way to get interested and get into the genetic counseling field, but typically individuals do have a bachelor's degree in some sort of science-related field, such as biology, genetics, social sciences like psychology. That is to say that if you have an undergraduate degree in a different specialty, that is also okay. There are a lot of people that are interested in genetic counseling and go on to become a genetic counselor as a second career path. Really what you need is some prerequisites that are very similar across the board in order to apply for a genetic counseling program, which we'll talk about in a little bit. Once you are accepted into a master's degree program, typically this is a 2-year training where you earn your master's, usually a master's of science. And throughout this 2-year program, you are trained in all sorts of genetic counseling specialties through coursework, clinical training, and there's usually a research component such as a thesis, project, or capstone. Then once you graduate, most genetic counselors go on to get their job and study for their board examination. Once you take your board examination, you earn certification, so you will become a certified genetic counselor. And some states do require licensure as well, which is very closely tied to board certification. Currently in Texas, we are not licensed, but in other states, you may have to do some extra licensing in order to practice. So as I was alluding to earlier, to apply for genetic counseling school, you generally need a number of different prerequisites. A lot of these are very similar to pre-medicine or pre-med requisites in undergrad. So these include your science degrees or science classes, biology, genetics, psychology, some math classes as well. Specific programs have different requirements that are usually listed on their website. Some schools do not require GRE scores anymore, but those that do, the students that matriculate, it's about 75th percentile for the math and reading portion of the GRE. And then GPA, typically you need a 3.0 or higher to be considered competitive, but this is not something that should deter you if you have a lower GPA. You just may need to strengthen your application in other ways. There are currently 51 genetic counseling programs in the United States and 4 accredited programs in Canada. You can find a list of these at the ACDC website listed here. There's one program that is starting to apply for accreditation, so it might be up and running in the next couple of years. So if we put all the programs on the map, you can see that there are quite a number in the, quite a few in the Northeast and Midwest, some on the West Coast. And down here in Texas, we have 2 that are both located in Houston. So of the 2 programs in Texas, both are located in the Texas Medical Center in Houston. The University of Texas program was started in 1989 and is affiliated with the Graduate School of Biomedical Sciences at UT Health. Most of your clinical rotations are through the different hospital systems with UT Health, such as Memorial Hermann and MD Anderson Cancer Center. And the current class size is 10 per class. The Baylor College of Medicine program started in 2018 and is also located in Houston. And it's associated with the Baylor College of Medicine School of Health Professions. And the clinical rotations take place in Baylor Clinics and Texas Children's Hospital. Currently, the class size for Baylor College of Medicine is 9 per class. And here are the websites for both of the programs, and you can find out more information about them on their website. And there are some photos of the current classes as well. So please check that out. Usually these programs and others across the United States and Canada do have some info sessions throughout the application season for their specific programs as well. So in addition to getting those prerequisites in order to apply, there are some other things that we recommend gaining experience in to apply to genetic counseling school. So that includes exposure to the field. So one of the most important things that you can do to learn about genetic counseling is to talk to professionals in the field and attend webinars such as this, where you learn more about the profession. Contacting a genetic counselor in your area can be very helpful. You can find some information about how to contact these GCs on nsgc.org, where you can find someone in your area that is open to prospective student contact. We know that with COVID, shadowing and observing has been fairly limited. Some clinics might start this up again soon. If you cannot shadow, then another great way to learn about genetic counseling is to meet or a person over Zoom or talk to them on the phone and have an informational interview. And all of these types of interactions are helpful to learn about genetic counseling, and you can add it to your resume. The NSGC website also has a Masters in Genetic Counseling series that has some simulated videos that you can watch that kind of walk you through what a clinic day might look like. You can also contact specific program directors and students to learn about their experiences. And then lastly, some individuals interested in getting into genetic counseling actually work as a genetic counseling assistant. So these are this is typically a clinic or a laboratory role where you work alongside genetic counselors, usually reviewing and triaging referrals, assisting with obtaining history information and scheduling. And this offers some direct shadowing experience as well. There is a genetic counseling assistant training program that's a few weeks long that is put on through Johns Hopkins. So if you're interested in pursuing becoming a GCA, then you can check that out as well. Other experiences that are helpful are including shadowing if you're able to, virtual or in person, research experience, whether that's an undergrad or postgraduate, lab work or clinical research can be helpful, and then attending recruitment events for specific genetic counseling programs as well. Another requirement that you may see when you're looking to apply for genetic counseling school is advocacy experience. So a lot of genetic counselors were very passionate about advocating for those in our community, and gaining experience in volunteering, specific types of volunteering can be very beneficial in your genetic counseling career. So some of the examples of volunteer experiences include working at a crisis hotline, working at a pregnancy center, domestic violence or homeless shelter, or a hospice. These are all different ways where you can learn how to communicate with people, especially going through kind of tough times, which ends up being a valuable skill as a genetic counselor. We encourage you to be creative. There are different ways to look into support groups and community outreach as well, to learn about different volunteer opportunities and participate in volunteering within the your local genetics community too. Then finally, so you have everything in order, now it's time to apply to graduate school, which typically requires a personal statement, some letters of recommendation, your transcripts from undergraduate, and then a CV or resume, and then some schools require a GRE scores. The genetic counseling program application cycle is based on, or is a part of a match system. And so typically applications open in December to February. Then once you apply to those programs, you may be offered an interview, which typically take place in February and April of the next year. Previously, these were in person, but they may be virtual again for 2022. So if you are invited to interview, then that's a day where you meet with the program faculty and learn more about the program to see if that's something that you're interested in attending the following fall. In order to participate in genetic counseling applications, you must register for the genetic counseling match. So this is a process by which you, if you are interviewing at schools, you will rank which school you like best and would like to attend in the order of your preference. And the schools themselves will also rank their applicants. And there is an algorithm through the match service that matches you with your highest ranked program, which is binding to where you will attend school. So you have to register for the match by December 15th of this year. Then you submit your rankings on April 13th, and then the match day where you find out where you're going to school is on April 22nd, 2022. We understand that applying to programs can be very costly, and TSGC as an organization is committed to improving diversity and inclusion. And so the Diversity, Equity, and Inclusion Task Force has created a scholarship that you can find out more information about on the TSGC website. This is for individuals that identify as Black or African American, where they can apply for this scholarship to have those fees waived for the matching service and the application programs in Texas. So strongly recommend that you check that out if that's something you're eligible for and interested in applying to. And with that, I will turn it over to our students.
Okay, great. So my name is Chandra. I'm currently a second year student in the Baylor College of Medicine Genetic Counseling Program. And together with Natalie, who is from the UT program, we're going to talk to you a little bit about the graduate school experience. So there are three core components typically to genetic counseling programs. The first being didactic coursework, which typically includes classes covering the topic of genetics, like clinical and medical genetics, embryology, population genetics, as well as topics like psychosocial theory, ethics, and counseling. And within these classes are often many opportunities to give presentations to your peers and course instructors. Secondly, the other major component is the clinical rotations. The structure and timeline of these rotations will vary between programs, but overall these will typically include rotations within the prenatal, cancer, and adult and pediatric specialties, and may also include elective rotations where you can choose to rotate in a specialty like research, industry, or other specialty clinics like mentioned by Hannah. And then many programs also will have you participate in weekly conferences where GCs, genetic counselors, geneticists, and other non-genetics providers will come together to talk about interesting cases in clinic and other topics related to medical genetics and healthcare. And then lastly is the research component, which again will vary between programs, but is typically a thesis project that you will complete over the course of your graduate career, and then you will defend your project at the end of before graduation. And now I will pass it on to Natalie.
Yeah, thank you, Chandra. So like she said, I am a second year student at the UT GCP, or the UT Genetic Counseling Program, and I am originally from Minnesota. I went to St. Thomas and studied biology and statistics, and then came to the UT GCP. And so some of the additional school experiences that you're able to have in genetic counseling programs are shadowing procedures. And so this includes procedures like colonoscopies, amniocentesis, fetal surgeries. So there's lots of cool opportunities for shadowing, especially in the Texas Medical Center. And there's also opportunities to present at grand rounds and journal clubs. So usually all of the specialties will have their own case conferences that happen weekly or monthly. So within the cancer counselors and prenatal counselors and pediatric counselors, you'll have opportunities to present updated literature about cool genetic conditions or to present cool patients that you've seen in clinic. There's also an opportunity for lots of community advocacy experiences. For example, both the Baylor and UT programs collaborated to do an event where we collected donations for refugees that were coming into Houston and helped distribute those to families. There's also opportunities for extracurricular educational opportunities, and this includes things like annual conferences at the national level and also at the local or regional level. And then you also will have activities with your mentor, so a faculty mentor and a second-year mentor, and then with your first-year mentor once you're, or your first-year mentee once you're a second-year student. So there's lots of opportunities, including the opportunity to be a teaching assistant and more. And so on the next slide, we wanted to show you some pictures of the students in both of our programs. And so here you can see pictures of both of our classes, and in the middle one there, you can see that event that I talked about with Baylor.
And then there are other opportunities such as in the top left there, you see some students from my program, some of whom are on the call today, where they were able to go to the Texas Capitol in Austin to learn about health policy lobbying, and some other various class photos over the years.
Yeah. And so the other thing I wanted to talk to all of you about is that Chandra had briefly mentioned a thesis project that you get to do when you're a genetic counseling student. And so the second years are in the process of doing this right now. And there was a question posted in the chat about what is one thing that panelists wish that you could see changed in the field in the upcoming years. And so one of the things that I'm passionate about is increasing diversity within the field and reducing some of the barriers to application that applicants experience. And so I am asking people who are applying for this upcoming cycle of genetic counseling programs and current first years. So anyone who's working on applications right now with the intention to start a program in the fall of 2022 is eligible for this survey. And so it's asking about barriers to genetic counseling admissions for underrepresented groups. But anyone is eligible as long as they're applying for this upcoming cycle or that they applied this past cycle and are a current first year. The goal of my project is to assess what barriers people are facing so we can help create intervention programs to make the field more accessible to all people. And so it's really important to get as many people as possible to participate in this so we can reduce some of these barriers. And as an added incentive, there is a chance to win one of 8 $25 Starbucks gift cards. So please, if you are applying for this upcoming cycle, scan the QR code, and I'll also post the link in the chat.
Great. And before we get to our Q&A portion where our wonderful panelists will be answering some of the fantastic questions that you've been posting in the chat and others, I wanted to give a few case examples to help you see what a day in the life of a GC may be like, or what real life is like as a genetic counselor. And my name is Sarah Huguenard. I am from Houston. I majored in biology and religious studies in Virginia, and then came back to Texas for graduate school at the UT program. And now I work at Baylor College of Medicine as a prenatal and cancer genetic counselor, and I'm also involved in the training program there. So I'm very excited to be able to speak with all of you high school, college students, graduate students who are college grads who are interested in genetic counseling, because as you can probably tell, myself and all of us are very passionate about getting the word out there about our wonderful profession that we love. So here are just a few case examples from 3 different specialties. Let's see. All right, so our first case example is in the cancer clinic. So Miss AJ is a 37-year-old female who's being referred to you for genetic counseling. She has no personal history of cancer, but she has a lot of family members who have had cancer. So her mom had ovarian cancer, her aunt had breast cancer, her grandmother had ovarian cancer. So lots of cancers in her family, more than we would expect to happen just by chance. And if you have any exposure to genetics, you may have seen something that looks like this. This is a pedigree. This is how we as genetic counselors look at the whole family at once to track cancers or other conditions, genetics or otherwise, that we think may be running in the family. So the reason that this case is important for genetic counseling is because about 5 to 10% of cancers in general are hereditary, meaning someone that inherited a gene that predisposes them to certain types of cancer. So looking at this individual's family history, I'm worried about a particular syndrome called hereditary breast and ovarian cancer syndrome. You may have heard of these genes before. Mutations in the genes BRCA1 or BRCA2 can cause this condition, and it causes an increased risk for many different cancers, particularly breast and ovarian cancer. If we know that someone has this condition, we can make changes to their medical management, including increasing their screening to detect a cancer early, which improves their survival rate and outcomes, or even sometimes preventative surgery to prevent those cancers from happening in the first place. So the patient elected to undergo genetic testing. A BRCA1 mutation was indeed identified, confirming she has this condition. She had preventative surgery to remove her breasts and her ovaries, which significantly lowers her cancer risks. And then her family members were also able to get tested for this genetic change that we know is running in the family, so that they can also hopefully prevent cancer from happening in the first place. So as I've been talking through this, some of you may have recognized who this is. This patient is Angelina Jolie, and this is true life, her personal and family history. She was on the cover of Time magazine several years back, and really, I think, made conversations about this type of testing more commonplace, which has really helped get the word out there about the opportunities through genetic testing for cancer conditions. Case 2 is in the prenatal clinic. So you have a 39-year-old patient. She comes at 13 weeks of pregnancy. She had routine prenatal screening, which is through blood testing through her OB, and she was referred to a genetic counselor to discuss her results because these results revealed that she had an increased chance of having a pregnancy with Down syndrome. So her blood test revealed that there was a 1 out of 50 chance, or a 2% chance that her baby had Down syndrome. So the genetic counselor explained what that testing meant, what it doesn't mean, her options to try to learn more, other than just that 2% about whether the baby actually has Down syndrome, including a more accurate blood test, ultrasound that can screen for some signs of Down syndrome, and then a procedure that Hannah mentioned earlier called amniocentesis, which can tell us for sure whether or not a baby has a genetic condition like Down syndrome. So the patient wanted to know for sure, so she elected to undergo this amniocentesis procedure, and the results showed that the baby did indeed have Down syndrome. So the patient considered her options and decided to use this information to discuss with her doctor whether she should deliver at a high-risk hospital. There are things that we do differently for pregnancies when we find out that a baby has Down syndrome or another genetic condition that make their delivery safer. For example, babies with Down syndrome often have heart defect, and we want to have a cardiologist specialist involved in the pregnancy and delivery so that that baby can do better. The patient also had a few months to prepare herself and her family members for the arrival of the baby, getting information and different tools that would be more helpful for a baby with Down syndrome. And then finally, I'll give you a case example from the pediatric clinic. A 4-year-old boy came to clinic because he was shorter than his peers. He was having some developmental delays, and he also had an insatiable appetite. So the parents remarked that he was floppy as a baby. He had kind of low muscle tone. And the geneticists and genetic counselors suspect a particular diagnosis, and they counsel the family about their testing options. So based on the genetic testing that the genetic counselor performed, we learned that this baby has Prader-Willi syndrome. So this is a rare genetic condition. Most cases are sporadic, meaning it hasn't happened before in the family. It happened just by chance in that baby. And the recommended treatment includes growth hormone therapy. So there's something we can do to help improve that child's health if we are able to identify which condition they have. The reason why a genetic counselor's role is very important in this particular case is because it's not an easy blood test. It's not a routine blood test or even a routine genetic test. There's a very specific type of genetic testing, a very niche type of genetic testing that is needed to diagnose this condition. And so that's why the genetic specialty is so important in obtaining a diagnosis for this child. So the patient was able to get the health care that they needed as a result. Before we move into our question and answer portion, I wanted to give you a little bit more information about something called Genetic Counselor Awareness Day. This is an annual day where we recognize and celebrate genetic counselors. And incidentally, it is this Thursday. So the genetic counselors in Texas, there are over 200 genetic counselors in Texas, and we come together to raise awareness of our profession through fun, different competitions and activities. So if you follow any social media accounts related to genetic counseling, including the Texas Society of Genetic Counselors Instagram account, you may be seeing some posts about this later this week. And then if you are interested in genetic counseling, whether this is the first day you've ever heard of it or whether you are actively applying to genetic counseling schools, these resources may be helpful for you. If you haven't already found it, the National Society of Genetic Counselors is a wealth of information about our profession. They have a page dedicated to prospective students that can really help you strengthen your knowledge of the profession. Regardless of whether you're just starting or whether you've been working on this for a while now. Of course, this webinar is hosted and put on by TSGC, so we would encourage you to look at our website where you'll also find a recording of this webinar posted in the next week or so. And then we also have links here to both the UT program and the Baylor program, which are the two programs in Texas that we've mentioned before. The American Board of Genetic Counseling and the Accreditation Council for Genetic Counseling are also helpful sites that can give you a more well-rounded view of the profession and its workings here in North America. So I know that we've talked through a lot of information in a short amount of time. We're also excited to see the collaboration going on in the chat here. Very excited to see people working together who are interested and excited about genetic counseling. So I wanted to start with our last few minutes here by asking our panelists, what is it that made you want to become a genetic counselor? What is it that excites you about genetic counseling?
I can take this one. So I think the most exciting thing for me in terms of genetic counseling is getting to work with patients and families. I think we get to spend a lot of time with our families and really get to know them. And I think that's the best part for me is just the time we get to spend with the families.
For me, I'll just quickly say that I was drawn to the fact that genetics as a whole is constantly changing, and especially now we're at a time where 5 years ago our practice looked a lot different than it does now, and that's just going to continue to change. And I find that really exciting that we have to keep learning and adapting to the increasing body of knowledge about health and genetics. And so that's one of the things that drew me to this field.
I think the thing that drew me to genetic counseling, and this is particular to being a mostly prenatal counselor, but I think it's true of all genetic counselors, is I love being able to be involved in what for many patients is one of the most difficult moments in their lives, and help the medical information make more sense, so that they're able to make decisions about their health, and learn more information about how they can, regain some control of their health or their family members' health. And I really find those relationships with patients very rewarding, as challenging as they may be. I'm sure we could answer that question for another 30 minutes, but for the sake of time, I'll move on to another question. That is, I think, the most common question in the chat, and maybe more helpful for some more recent grads to answer than me, especially given COVID. What are some additional resources, in addition to the ones that we presented, that prospective students may find helpful in their journey toward becoming a genetic counselor, whether resources that can help people learn more about genetic counseling or get more experience, since shadowing opportunities are limited at this time?
Yeah, I think it's really helpful to do informational interviews with genetic counselors who are willing. I also know for a while that UT Southwestern in Dallas was letting prospective students attend case conferences so that they could get experience in seeing what a case conference is like, and hearing some more of the terminology used in cancer genetic counseling. But I think programs are aware of some of the limitations due to the pandemic, and so informational interviews can be a great tool for learning more about the field and getting some of your questions answered.
And also, attending webinars like these, you can certainly put that on your resume. I had a whole section just labeled, genetic counseling exposure. And most of my exposure was from informational interviews. I really didn't shadow much at all. So webinars and informational interviews, like Natalie said, and then she alluded to, reaching out to genetic counselors in your area, or even all across the country, to see if you can join in on their faculty journal clubs or case conferences like Natalie mentioned. I did something similar, and that was really helpful for me, again, to just get familiar with the language and more the environment of the field itself, and that will help you learn about is it something you're interested in.
I would definitely recommend using that NSGC Find a Genetic Counselor tool to find someone in your area who can connect you with some of those more concrete opportunities. Some of you mentioned internships are limited. They're limited from the outset, even in a non-COVID year, but certainly there are very few. Actually, I don't know of any that happened this past summer in person. So definitely reach out to a genetic counselor in your area to learn more. I wanted to also, for our final question here, pull a question from the chat that Natalie answered already for us, but I'd like to hear some other perspectives. What do you think, what would you like to see change in the next 5 years in the field of genetic counseling, or where do you think the field of genetic counseling is going?
I can kind of take a stab at this, and I think a lot of us, or if not all of us, would like to increase diversity within the field. I saw someone mentioned on the chat that it seems to be a female-dominated profession as well. So we would love it if we had just diversity in all areas of ethnic background, race, and gender. I think the field is currently like 90% women, which is awesome to have a healthcare field that is so female dominated, but we would love to have more people from different backgrounds in the field as well. And I think in addition to that, genetics is changing so rapidly, and I think genetic counseling as a profession is growing in a way that it will become more commonplace to know genetic counselors and other healthcare professionals to know us as well. And so I anticipate that in the next few years, the profession will grow and kind of go into some more specialty roles like Hannah was mentioning earlier, where genetic professionals are not just limited in the current job opportunities, but are expanding into much more diverse areas to work in as well.
I think that sums it up very well, and is a great way to conclude our presentation today. Thank you all so much for joining and for your excellent questions. I hope that we've answered most of your questions, but if not, please feel free to reach out to TSGC or to a genetic counselor in your area. Again, thank you so much for joining us today and spending your time with us. As a reminder, there will be a recording of this webinar posted to the Texas Society of Genetic Counselors website. We wish you the best in your endeavors, and we hope to see you as a colleague someday in the future.